Good afternoon, everyone. My today's topic of discussion is balloon pulmonary valvuloplasty or BPV. It's a life-saving intervention for pulmonary valve stenosis. Welcome to my channel eduhub.2m and I am Dr. Jayati Sen, regularly uploading new videos regarding various paramedical and medical topics. So please do like, share and subscribe my channel and keep in touch with me. So first of all, we have to understand the pulmonary valve stenosis. Stenosis means hardening of the valve. So why this? What is the obstruction actually? Narrowing of the pulmonary valve obstructs the blood flow. Pulmonary valve is obstructed. So which one is obstructed? Pulmonary valve obstructed. And which obstructs the blood flow from the right ventricle to the lungs. Why the blood from the right ventricle goes to the lungs by the pulmonary blood vessels? For the purification in the lungs. So we can interpret easily that as because there is a stenosis, ample amount of blood cannot go. So definitely there will be less purification of the blood in the lungs. Now what is its impact on the heart? This obstruction leads to right ventricular hypertrophy. Now what is the meaning of hypertrophy? Hypertrophy means enlargement. So there is an enlargement of the right ventricle. And the symptoms like fatigue, it's obvious because less amount of oxygen is less amount of oxygen is available in the blood because less amount of blood is purified in the lungs. Then dyspnea, that is shortness of breath, and eventually heart failure. Now what are the primary cause? Congenital malformation. That means if any abnormality is present in the valve, present from birth, that is called congenital abnormalities or malformation. It is the most common cause with severity ranging from the mild to the critical obstruction. The evolution of balloon pulmonary valvuloplasty, BPV, that means how it comes from the very early stage. In 1982, there was a pioneering treatment. The first successful catheter-based pulmonary valvuloplasty was described by Can et al. So Can et al. In 1982 first described, and it is regarded as the milestone for this BPV. Now, BPV rapidly replaced a traditional surgical valvotomy. Valvotomy means to remove the valve, as the preferred treatment for isolated pulmonary valve stenosis due to its less invasive procedure. So when you have to do the surgical valvotomy, you have to do more invasive procedure. But in case of the balloon pulmonary valvuloplasty, you have to do less invasive nature. So it is much more popular than the traditional one. Now, balloon innovations. Early balloons like Diamond and Marshall, these are the name of the balloons, paved the way for advanced designs like Taishak et al., Taishak 1 and 2, and the latest Acura balloon. So the latest one is Acura balloon. You have to understand and you have to remember. How balloon pulmonary valvuloplasty actually works. You can see in the picture that a balloon-like substance is inserted into the artery. Now, a specialized catheter equipped with an inflatable balloon, inflatable means which can increase in size, is precisely guided through the femoral vein. That things you have to remember, through which the catheter is inserted, through the femoral vein to the pulmonary valve in the heart. What happens then? Once in position, the balloon is inflated gently. Gradually the balloon is inflated, stretch and tear the fused valve. Leaflets. That means due to stenosis, the valves are not opening properly. The valve leaflets are not opening properly, and this ballooning system actually opens the fused valve, effectively relieving the obstruction and restoring the proper blood flow. This minimally invasive procedure is typically performed under local anesthesia. So in this case, in traditional cases, total anesthesia is required, but in this case, only local anesthesia will do the need. Now, what is the real world success? The Acura balloon successfully treated a 15-year-old patient with severe stenosis dramatically improving heart function. So it is proved that balloon pulmonary valvuloplasty is very much helpful in case of this stenotic environment. Now we learn about the advantages of modern balloon technologies. Now, Aquera balloon features a shorter length, faster deflation, and self-positioning capability. This is very important. When a balloon is inserted, it self-positioned itself in the place of the problem, significantly reducing the slippage, which is called the watermelon sitting. During this procedure means the balloon find its way, it goes to the position, and it is have the self positioning capability, and it does not slip from the particular problematic situation. So it is Acura balloon. The second one is tie shack balloon. It is widely used. Their longer design carries a slight risk of tricuspid valve injury. This is somehow overshoots the Acura balloon than the tie shack balloon. Next, tailored sizing. As we have already discussed, the balloon size matters. Balloon size is meticulously chosen based on the valve annulus diameter and the patient age. That means what is the diameter of the valve annulus and what is the patient age, ensuring the optimal result and minimizing the risk. So regarding the clinical outcomes and long-term benefits, BPV consistently delivers a significant gradient reduction. Gradient reduction means the pressure that was exerted by the heart is gradually reduced. This is the pre-BPV gradient, that means it's much higher, and this is after BPV, it is much more reduced. Now transforming the cardiac function definitely in a better side. Post procedure, the valve orifice diameter doubles. Definitely whatever the problem was there, it is not now persisting. So the orifice diameter is also double, drastically improving the blood flow efficiency. What are the risks and considerations? Valve insufficiency means the primary risk involves pulmonary valve insufficiency or regurgitation. Regurgitation means backward flow of the blood due to intentional leaflet tearing. However, this often resolves or often mild over time. So if there is a valvular insufficiency, that's a risk factor. Some rare complications are there, like conduction disturbances or the tricuspid valve injury. Then the ballooning cannot occur properly. Challenging cases, if there is dysplastic or heavy calcified valves, means if the valve is very much deposited by something, then the valve is very much hardened, and then in that case ballooning is not, sometimes ballooning is not possible, and then surgical intervention is required. Then lastly, ongoing monitoring is very important in these cases, that whether the valve is actually working properly or not. This is the future of pulmonary valvuloplasty. Advanced balloon designs are required, and it is already going on research on that. Then fetal interventions means early treatment before birth. If the treatment can be done before birth, then after birth the person can live happily. Then combining the therapies for the success. So BPV continues to evolve, solidifying its role as a cornerstone, minimally invasive therapy that profoundly transforms outcomes for individuals with congenital heart disease. So it can be proved as a relief for the congenital heart disease patient. Thank you for your patient listening. Hope this video helps you to upgrade your knowledge regarding balloon pulmonary valvuloplasty, and keep in touch with me for getting more advanced videos regarding all these topics. Thank you.